Hello friends, I am Dr. Krishna Chaudhary, cosmetic surgeon practicing at Cosmetic Laser Surgery Center, Prasad Chambers near Sonal Marriage Hall and Hindustan Petrol Pump, Karve Road, Pune, India. Friends, excess skin and bags are usually the telltale signs of aging that prompt patients to seek cosmetic eyelid surgery. There are various surgical techniques to address this stigmata of gravity and aging. Patients who are interested in surgery for cosmetic purposes are asked about their motivation for the surgery and their expectations of the surgical results prior to considering if they are appropriate candidates. Patients often report drooping, sagging, tired appearing eyelids that interfere with various activities of daily living. A complete medical and ophthalmic history is obtained that includes previous ocular conditions and surgeries, prior cosmetic procedures, dry eye symptoms and treatments, complete list of medications including blood thinners and herbal supplements, and psychiatric history also. Eyelid examination helps in understanding quality, quantity, and relative symmetry of redundant skin. Eyelid crease height and symmetry, grading of medial and central pre-aponeurotic fat pad herniation, evaluation for lacrimal gland prolapse, evaluation for presence of concurrent ptosis. Measurement of brow position as patients with significant brow ptosis should be considered for a concurrent brow lifting procedure at the time of blepharoplasty. Legophthalmos on attempted eyelid closure, presence of intact Bell's phenomena, evaluation of lower lid laxity, eyelid or eyelash malposition, orbicular strength and orbital symmetry. Indications for upper blepharoplasty include redundant and lax eyelid skin and pre-aponeurotic fat herniation that result in either functional or visual symptoms or cosmetic concerns in affected patients. Contributing factors to upper eyelid laxity and pre-aponeurotic fat prolapse, actinic changes to skin due to sun exposure that result in loss of collagen, elastin, and ground substance. Weakening of the orbital septum resulting in herniation of fat, weakening of levator aponeurosis causing associated involutional ptosis. Now the surgical technique, upper blepharoplasty. Eyelid incision is marked with the patient sitting down and looking straight ahead to a fixed point, highlighting the excess tissue to be resected. Upper eyelid incision with CO2 laser in the highlighted place. Removal of strip of orbicularis muscle from the eye is preseptal portion and the fat pouches are dissected. Excess fat in the pouches are shrunk and reduced by laser in defocus mode. Intradermal continuous skin suture with 6-0 chromic catheter. Blepharoplasty is among the most performed cosmetic surgeries and its main goal is to promote rejuvenation, functional and cosmetic enhancement of the periorbital region. Complications are uncommon and when they happen, they are usually mild and transitional, such as hematomas and chemosis. Nonetheless, sometimes they can be very definitive, such as blindness, or they require new surgical approaches for correction such as ectropion and eyelid ptosis. Complications, prevention, or even their forecast starts with a careful preoperative assessment. It is always include a detailed clinical history and careful physical exam. The assessment of the patient's psychological aspects and the patient's expectations regarding surgery are also very important. The surgical technique to be used is based on anatomical changes found and the patient's complaints always taking into patient's expectations and the real surgical possibilities for cosmetic improvements are considered. Post-operative regimen, patients are instructed to use ice compresses frequently for first 3 days after surgery. Antibiotic ointment is prescribed for the incision sites 3 to 4 times a day. Should avoid lifting, bending, straining exercise during first 10 days after surgery. Call if experience of any loss of vision, double vision, bleeding, severe swelling or pain. Follow up within 1 week of surgery for a post-operative evaluation. Complications do occur, although rare, is the scarring at the incision site, asymmetry, overcorrection, undercorrection, medial canthal webbing, lobophthalmos, ocular surface exposure, retrobulbar hematoma, loss of vision, perforation of globe, ptosis, numbness beneath incision line, patient dissatisfied with the cosmetic outcome. Friends, you are most welcome to inquire for more information. You can always talk to me. You can phone me on 937-350-4565 for more information or to avail the facility of free consultation. Thank you, friends. Friends, red arrows clearly points hanging, hooding of upper eyelid skin on both sides. Also, there is mild eyebrow ptosis. Ptosis means it has come down slightly. This pinchable laxity will be removed with the laser upper eyelid blepheroplasty, and it will be done under local anesthesia. Laser upper blepharoplasty, it will be done under local anesthesia with the help of CO2 laser. CO2 laser is a very versatile cutting laser which gives almost bloodless field. Therefore, post-operatively, there is not much of swelling or bleeding and healing is very fast. This laser is used. Before that, local anesthetic is infiltrated. This numbs the area and also minimal bleeding is there. This also helps in hydrodissection and lifts up the skin. The CO2 laser settings are set. Usually around 5 watt energy is used in a surgical mode. You can appreciate the dry field. The smoke is evacuated. Traditional incisional surgery causes lot of bleeding and post-operatively swelling because of bleeding. CO2 laser minimizes these problems, and since it sees blood vessels and nerve endings, it is almost painless. Here the skin flap is removed. Now orbicularis ocular muscle, that pinkish one, is shrunk in defocus mode by CO2 laser. You can appreciate it is shrinking down and the deep valley is created. Post-operatively, you can see yellow arrows pointing towards now normal eyelids without any hooding. This is 6 months post-operative results. So right side and left side oblique view shows very clearly that hooding is gone and natural crease is visible. As such, patient has got
small eyes.
Thank you, friends.